Okay, so I'm going to start with the usual 360 of the room. Okay, my desk is covered, I have no notes on there. I got my syringe, I got my alcohol wipe vial, I got my drug handbook, and I have my MAR with nothing on it. Okay, now I'm going to start. So I'm going to start proper hand hygiene. Then I'm going to go on to the EHR. I'm going to check if the patient has any outstanding medication orders from a provider, physician, and I'm going to see that Mr. McDougall has a order for human R insulin, and we're going to now check on the MAR, double check that this is correct. We're also going to notice that there is the patient history, or past medications, or even current allergy. We're going to learn that the current allergy that Mr. McDougall has is an allergy to penicillin and sulfate. We're next going to move to the drug handbook, and we're going to flip to the human R page. We're going to learn about the mechanism, the action, the drug-to-drug interactions, the contradictions, and the possible side effects of human R. After reading the drug handbook, we learn that human R is used to treat type 2 diabetes. It will lower the blood glucose levels, and something that can happen is hypoglycemia. And due to hypoglycemia, some side effects that can happen are a fast heart rate, palpitations, or even shakiness. So next, what we're going to do, we're going to don our gloves. We're going to go from the knowledge that we know from the case study. Mr. McDougall has a blood glucose level in the 350s, around that area, and due to this, from the chart, we know that he will be administered 4 units of human R. So now, since we know the kind of medication and the units or dosage that we need, we're going to obtain the insulin from the medication cabinet. Once we get the vial, we want to observe if there's any cloudiness or any sediments in the vial, and make sure it's very fluid, there's no clumping or anything, and that the seal is not tampered. We're also going to make sure that we have our 100 unit syringe, and we also have our alcohol swab. So what we're going to do, we're going to take our alcohol swab. We're going to wipe the top of the vial in a circular motion. We're going to take our syringe. I'm going to take the cap off. I'm going to place it on the table. Okay. So now what we're going to do, since we are going to administer 4 units, we're going to draw back 4 units of air in the syringe. Okay. We're going to hold this like a dart. We're going to insert the syringe on the top of the seal of the vial. Okay. We're going to expunge the air. We're going to invert the vial, and we're going to draw out 4 units. Okay. I'm going to lift this off the vial. We're going to observe any air bubbles, give it a couple flicks. Doesn't look like we need to allow any additional air. We're going to do the one-handed technique to put the cap back on, just like this. Okay. Now we're going to secure the cap. Okay. Now before we leave for the patient's room, we're going to double check and make sure this is the right medication. This is our second check. We're going to check the EHR, we're going to check the MAR, and even the drug handbook, just to make sure this is the correct medication for this patient. Also, I'm going to remove my gloves, do proper hand hygiene, and prior to entering the patient's room, I'm going to do hand hygiene once again, and I'm going to don the proper PPE since the patient is in reverse isolation. I'm going to put on a mask, I'm going to put on gloves, and I'm going to put on a gown. So let's move to the patient's bedside. Like I said, prior to entering the room, I'm going to put on the proper PPE. Okay. All right. Good morning, Mr. McDougall. My name is Nurse Kenneth. I will be here to help you today. I'm going to be administering your insulin injection. We're first going to start. Can you please verify your first and last name and your date of birth? While he's telling me his information, I'm going to check his bracelet and make sure that the information he gives me matches up with his bracelet information. Okay, the information on your bracelet matches. Now, can you tell me if you have any allergies to any medications? Mr. McDougall is going to tell me that he has an allergy to penicillin and sulfa. Okay, so now what I'm going to do, I'm going to close the curtain. While closing the curtain, I'm going to make sure I keep my eyes on the medication at all times for safety purposes. And now I'm going to do my last check of the medication. I'm going to check the EHR or even MAR on my rolling cart. I'm going to make sure that this is the right medication for this patient. At this time, I also want to note the 5 additional rights of medication administration, which are right assessment, right evaluation, right documentation, right education, and the right to refuse. Okay, Mr. McDougall, I'm going to give you some more insight on the procedure and the side effects of this medication. So I'm going to be giving you a subcutaneous injection of humoral R insulin. I'm going to be giving you this injection in your abdomen area 2 inches away from your umbilicus. What this humulin R does is usually used to treat type 2 diabetes and will lower your blood sugar or your blood glucose levels. One thing that can happen or may not happen, you may experience hypoglycemia. Due to this, you may experience a fast heart rate, palpitations, or even shakiness. Before I administer the medication, I just want to take your apical pulse to make sure everything's okay before I give you the medication. Okay, apical pulse is normal. I'm going to document that. EHR. Now, I'm going to raise the bed. I'm going to lower the rail, side rail of the bed. And now I'm going to clean the injection site. Okay. Okay. Now I'm going to take the syringe, remove the cap. Okay. Now I'm going to inject this subcutaneously at a 45-degree angle in the abdomen area, 2 inches away from the umbilicus. I'm going to pinch the skin gently, and I'm going to insert the needle at a 45-degree angle. Okay, I'm going to let go of the skin. I'm going to stabilize the needle, and I'm going to inject the medication. Okay, now I'm going to release the needle. I'm going to draw it back in the same angle that it was inserted. Very good. Now I'm going to put the safety cap on. I'm going to dispose of this needle in the sharps receptacle. Okay, Mr. McDougall, your injection is finished. I just wanted to let you know if you start to feel any side effects or something's bothering you or you just need something, please feel free to call us. That's what we're here for. If a nurse is not nearby, you also have your call bell. Please ring your call bell, and a nurse will be at your side momentarily. I'm going to check back on you to make sure that you don't have any of those side effects that I mentioned. I'm also going to measure the therapeutic effect of the medication that was administered. And that'll be it. I'm going to exit the room. Before exiting the room, I'm going to take off my PPE. I'm going to dispose of it, do proper hand hygiene. I'm going to exit.